Hello, I'm Rebecca Shenalue, the Cancer Support Program Coordinator here at Enloe Regional Cancer Center. Thank you for taking the time to watch these new patient welcome videos. These videos help you know what to expect and give you tips so that you have the best possible experience here at the Cancer Center and Enloe Comprehensive Breast Care Center. Invite anyone who might be involved with your care to watch the videos. It will help you all get on the same page. And also remember that you can pause the videos or watch them more than once. The time after your first visit with your doctor is a time of adjustment. You may still have questions. You're trying to figure out how to talk with your family. You might be wondering about more of the specifics like, will my insurance cover this? These are some of the things that we're going to cover in this video. Either at your appointment or shortly thereafter, you'll be offered a patient guide binder from your doctor's nurse if you're to receive cancer treatment or surgery here at Enloe. If your first visit is via telehealth, you can arrange to pick up the binder at your convenience. And if you're here for your appointment, just ask for it before you leave. The new patient guide was designed with lots of patient input to provide you with easily understandable information on topics that are important to cancer patients. If you open your binder, you'll see a welcome page, which includes tips for how to use the binder. Patients expressed to us in our focus groups that it was easy to get overwhelmed. Can you relate to that? So we're going to be addressing that throughout this video. For starters, we've narrowed the information in this binder down to just the info that we think pertains to most cancer patients. Additional information for specific situations like going to your job during cancer treatment, or being single and dealing with cancer, or tips for families. These can all be found on additional resource sheets mentioned in the guide in green. You can request those from your nurse or from me here in the Cancer Center Library. In the back of your binder, after the tab called Your Education, is a good place to keep any additional education that you receive. And if you're going to get chemotherapy, you'll find the Chemotherapy and You booklet already back there. So this quote, "At first, I found myself easily overwhelmed by too much information. It helped to focus on just one thing at a time, conquer that, and then move on." This quote is straight from a young guy who was one of our patients, and it's excellent advice. If you are the type of person who would gain comfort from reading this binder cover to cover, then go for it. But we added a table of contents, and that's because we recommend you just go to the section that you need and save the rest until you need it. You don't have to digest it all at once. Let's look at the personal organizer. This was also created in direct response to feedback that some people don't like carrying the big binder around. They wanted something handier. So we recommend you use the white binder to store all the information from us in one place at home. It becomes your resource center and also a very handy way to grab everything that's going on with your cancer care. If you need to go to a different institution or you start seeing a new primary care physician, it's all right in one place. Then the personal organizer is what you carry around because it has a directory of all the phone numbers you might need and places to write things down while you're here. There's even a little pocket in the back where you can put loose papers until you get home and can file them in your binder. Both the organizer and the binder are great tools for organizing things, which helps with the feelings of chaos. After your first appointment, you'll have time to learn more about your cancer. Patients and caregivers are all different in terms of how much information they want, but most people feel more in control and less stressed when they understand what kind of cancer they have and what to expect in terms of treatment. Now, after your visit, but before you start any treatment, your doctor's nurse will offer you additional education, and she will also talk to you about your treatment calendar and about your medications and or your radiation treatments. This time after your first appointment is a good time to learn what some of these things mean that your doctor is talking about. Do some research or have someone do the research for you. You'll find a list of reliable websites in the patient guide binder in the section called Your Type of Cancer. So if you're looking for reliable websites, go to Your Type of Cancer. And if you're not an internet user, I'm available to help you in the Cancer Center Library. I can offer you additional info that's easy to understand in good old-fashioned print on paper. If you're going to start chemotherapy in our infusion clinic, you will receive additional education from your infusion nurse, and you'll be able to watch the chemotherapy education video with your family caregivers at home so that you all have a good sense of what's going on with that. We understand that it's hard to absorb everything, so we offer many opportunities to receive the information you need so that you can understand what's going on. Let's talk a little bit about information that's available on the internet. Many people avoid online information because it's overwhelming and you don't know what to believe. But as a cancer educator, I know that many reliable organizations, like the American Cancer Society and the National Cancer Institute, are now directing people to their websites because cancer care is advancing so fast that little printed booklets we used to use quickly become outdated. Those organizations want you to go to the websites for the most current information. So, what we all have to do is learn how to find reliable information online. There are a few easy questions that you can ask yourself whenever you're presented with health information from the internet. And this is really handy when family and friends try to hand you things they've printed off from the internet. Ask yourself, are they making claims that are too good to be true? Are they trying to scare you into something? Are they trying to sell you something? These are some red flags that mean you need to dig a little deeper. And honestly, to keep it simple, the best bet for up-to-date information based on scientific research is to go to reliable websites like the American Cancer Society, the National Cancer Institute, cancer.net, or ChemoCare. These are all listed in your binder. And the information on these websites is written by professional educators, and it will be written in an easy to understand and encouraging way. One more tip about online resources, and I got this tip from a stage 4 ovarian cancer patient named Olivia. She joined an online forum about ovarian cancer to keep her up to date with any new developments related to her cancer, and it also introduced her to a community of people who could relate to what she was going through. I think finding an online network at a reliable organization is a great way to find information and get support from others who understand what you're going through. But Olivia learned early on that spending all her time on the computer reading about cancer stuff made her depressed. So she told me she stopped looking at online cancer stuff first thing in the morning. She did not look at cancer online stuff after dinner or before bed. She did her cancer online stuff in the middle of the day, and she limited it to a half an hour. That's enough time to see if there's anything new going on and to touch base. And instead of hanging out online, she took up painting, and she painted something like 500 paintings in the years she lived after her diagnosis. I love this tip from Olivia, and I strongly recommend it to people using the internet as a way to deal with their cancer. Let's talk about talking about your cancer. You know, when you first get your diagnosis, if you picture your life as a pie chart, you all know what a pie graph looks like. I bet that cancer took over pretty much every piece of the pie. But now that you know your diagnosis and have some idea of what's going on with treatment, you can start narrowing the amount of energy you and focus you put on this and gain back some of the rest of your life as normal. And one of the ways that you can do that is by deciding how and when you want to talk about your cancer. This is particularly helpful for couples who might want to have a little conversation about what works best when it comes to talking about cancer. Cancer can be a tough topic, and people look at it in different ways. Some families decide the dinner table is a perfect place to check in and give updates about what's going on with mom's cancer. Other families might decide the dinner table cancer is off limits. We talk about everything else that's going on in our lives. I'll give you an example of the different ways couples might talk about the cancer. So one person has been thinking about something all day that they know they need to bring up with their partner, but they haven't done it, and it's time to go to bed. The other person is getting ready for bed and thinking, oh, I can't wait till my head hits the pillow. I am so ready to close the light on this day and start fresh tomorrow. And the light goes off. They they lay down, and what does that first person say? I've been thinking about the cancer. Perfect time for them. Lights are off, relaxing, don't have to look the other person in the face. But for that person who was just ready to go to sleep, it's like, oh, this is the worst possible time. So maybe if you have some conversations about, let's just talk about cancer over coffee, that would be helpful. And it's not like anybody's going to throw you in jail if you break the rules, but they're just guidelines to help make things easier for you both. What about family and friends? Sometimes people say the most awkward things. People normally don't know what to say. I have a whole resource sheet called Talking with Someone Who Has Cancer, just to give people some education about what's appropriate and what's not appropriate to say when you're talking to someone who has cancer. But you might find yourself, you know, I'll give you an example. Standing at the store, you just want to run in, get a gallon of milk, and get home and get your feet up at the end of the day, and you see someone you know, and they give you the look, and then they take a deep breath and say, oh, I've heard what's going on. How are you doing? And you're thinking in your head, how I'm doing is I really just want to get home and relax and not talk about this right now. But because we're taught to have good manners and because we want to be polite, we try to figure out what to say that satisfies them and satisfies you. It might help to have a line practiced, and it might go something like this. You know, one thing we've decided is we're not going to let this take over our lives. And one of the ways we're doing it is by not talking about it all the time. How are you? And ask them a question. Or just say, we're not talking about it all the time. I'd love to get together with you later, but I'm just heading home and I'm ready to rest. You can choose when and how you want to talk about your cancer. Before we go off this slide, I just want to say that this doesn't mean you shouldn't talk about your cancer with someone that you trust, that you shouldn't talk about your cancer. I don't want anybody leaving this video saying, Rebecca said I don't have to talk about my cancer. You should talk about your cancer. It's healthy. When we don't talk about things, they build up and tend to come out in unfortunate ways. So it's important to talk about your cancer with someone you trust at a time in a place that's comfortable for you. These tips and other tips are in your binder, and I have additional resource sheets for talking to children, talking to employers, or talking to coworkers if you call me or email me or come down to the library and ask me about that. After your first visit is a good time to set up a system for communicating with others and to do some planning for your practical needs that might come up during treatment. Some people keep it really simple and they set up a group text or a group email. There are some really helpful online services that are free and easy to set up, and they can make communication even easier with your network and can help you schedule help. Caringbridge.org is one, and Lots of Helping Hands is another one. If setting this up seems intimidating, Delegate it to someone else who can help you simplify your communications or help you work out what works best for you. I know patients who have done this. You tell one person what you want to go out to the masses, and then their job is to figure out how to get the information out best. I want to talk a little bit about fatigue and asking for help. Fatigue is the most common side effect of any kind of cancer treatment, and most patients need to build being a little bit tired into the plan. When you're dealing with cancer treatment, your energy needs to be managed kind of like a checking account. Just like when we're low on cash, we get very careful about how we spend. In the same way, when you're low on energy, you want to be very careful about how you spend it. One way to boost your account is by organizing some helpers. When people first hear about your diagnosis, they might say, "What can I do to help?" And you probably still have no idea of exactly what you'll need. So you might be tempted to say, "Oh, no, 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 we're doing fine." Or you might think, "I can cook my own dinner. I can vacuum my own floor. I can mow my own grass." But remember the checking account metaphor. And what I would encourage you to say when people come up and ask if they can help is something like this. "At this point, we're still figuring things out, but I'd love to get your contact info." Start a list on paper or in your phone. Share the Care, which you see here on the screen, is a book and a website with tips for helping you organize help. And they even have a little form that you can use when people ask to help. I have copies of it in the library. But I wouldn't turn people away when they offer to help. I've heard people making the mistake of saying, "No, I've got it covered," at the beginning. And then further down the road, when they really could use some support, people have stopped calling and asking because they were told that they weren't needed. Now, there are some people who are going to cruise through this. You're not going to need any of the things that I'm talking about. There are other people who are going to be cruising and then they'll hit a bumpy spot. And then there are going to be other people who need help every step of the way. There'll be some people who end up with whole teams of people who help. And some people might end up with just one or two. You might feel like you have nobody. I want to tell you that sometimes it's the person you least expect who shows up out of nowhere who will be your biggest supporter. I know one woman whose hairdresser ended up being her primary caregiver. And I also want to mention, just because it's so common, that sometimes the person you thought was going to be there for you the most sort of drops off the map. It can be heartbreaking. It's your best friend, it's your son, and you're thinking, "This is the hardest thing I've ever been through, and you're not showing up, you're not calling me." And we know it's not because they don't care. It's usually because they care so much they don't know how to deal with their feelings and they don't know what to say, so they just sort of check out. Fortunately, there are other people who don't know you as well, who will offer, and you may be surprised thinking, "I don't even really know her that well." Guess what? They've probably been through this before themselves or with a loved one, and they know how nice it is to have someone else drive you to a treatment or bring you a meal. They won't fall apart every time they look at you. These are your new best friends. These people are your angels. When these people ask you how they can help, consider it a gift from the universe. I mean, I would bet if you asked people why they want to help, they would say, "Because it makes me feel good. Because somebody helped me. Because I love that person." When you let people help, you give them those good feelings. And I frequently hear people say how their cancer experience, as difficult as it is, gave them a better understanding of what it means to be human and what it means to love. And that's what happens when we let people help. That's the end of my sermon on help and setting up good communication networks. I want you to know about our financial navigators here at the Cancer Center. Be proactive about financial matters. Learn about your insurance coverage. Understand deductibles, and talk to financial navigators early on if you think you're going to need help paying for drugs or co-pays. There are programs available to help, and these financial navigators are superheroes. They understand this stuff. Getting a handle on the financial picture will help you avoid frustrations and surprises. Contact them. And they've also asked me to explain to you that they are not a collection agency. They're not asking you for money, they're trying to get you money. So if they call you, please call them back. And very important, if your insurance changes, if you decide to change your plan, don't wait until your treatment day or your appointment day to let us know. Most cancer care requires pre-authorizations that can take days to get, so please inform the financial navigators as soon as possible so they can have everything in place when you come in for your treatment. The time after your first appointment and before your first treatment is a time of figuring things out and adjusting to the news. Take care of yourself. Rewatch video number 3 and practice some stress busters. You can pause or rewatch any of these videos if you feel like you didn't get it all, or just give me a call and we can talk it through. That's what I'm here for. I look forward to meeting you. Thanks for watching.